Hi, Dr. Peter Lind. One of the major problems that we have coming through our office is pain. I mean, isn't that what drives people, is pain, trying to avoid it? Well, there's different kinds of pain that we see and that you may have as well. You might have the chronic pain. It just never goes away. It gets better and it gets worse, but it just never goes away. That could be, now get this, it could be a blood sugar problem. You may not be getting the blood to that area of problem, and so it can't heal. It could be a functional brain imbalance. How could that be? Well, part of the parietal lobe in the brain controls or is a sensory map of the whole body. And if the functions or the connections between the hypothalamus, and I know these are brain terms, but that's how we talk about it. If there's dysfunction in the connections, you're not going to get correct feedback to the body part that's being affected. So you can't heal until the brain system gets back to normal again. So it could be a brain problem, it could be a ligament problem, it could be a bone, a nerve, multiple problems of pain. So taking medication for pain is like, wait a minute, shouldn't you figure out what's going on? We get people in here with multiple surgeries and they still have the problems. I have a guy right now, multiple people that have multiple failed surgeries and they want to have another surgery. I'm thinking, maybe that's not it. What's going on with this person's metabolism, their physiology, their neurology, that they have to have pain? So pain is important and it gives us a clue into finding out what's going on. So we want to test the person out, their physiology, their neurology, finding out, do the test to find out what's going on and apply the appropriate protocols to get that part of the body fixed so the whole system gets better. So chronic pain, boy, once it turns chronic, it's tough. It gets tougher every month and year as this continues, but there are answers. The first place you have to start is doing the appropriate tests metabolically and then neurologically, figuring out what's going on, put a plan together, put the protocols in place, and do the right things for that person to get better again. So they don't need to have, number one, they don't need the pain, and number two, they get better. That would be a great plan. I hope this has been helpful for you. I'm Dr. Peter Lind, and we'll speak again next time.